Welcome to Wrestling with Goals, the Conceive, Believe, and Achieve podcast. Today's guest is Dr. Pat Graham from the Core Optimum
Health and Performance Center.
Awesome. Yes. That's a mouthful.
It is a mouthful, yeah. But we want to make sure we got the performance part in, not just the health part in. So
that's right.
Because we do a lot of work with athletes, and we try and look after their injuries and stuff. But we also want to make sure we can help them and improve their performance and things like that. So
awesome. Yeah. No. You know what? That's I came to you guys a while back. Probably I can't remember. Maybe 6 or 5 years ago.
Yeah, probably 5-6 years ago.
As a result of a work-related injury, I was hit by a motor vehicle.
Right.
And I received a concussion.
Yeah.
So I came to see you guys because I had a mutual one of the guys that works here, Scotty Payne. He works here. He told me about you guys.
Yeah.
So I came in, and you guys treated me for better. So I want to talk a little bit about my journey with you guys as well. But I want to talk about your background because I think it's applicable. We are a sports podcast.
Right.
Wrestling, let's say, wrestling is where we kind of, sit our hat. But you've been in sports for a while. You played in the NHL.
Right.
Well, which teams?
I was with Pittsburgh for 3 years and with the Toronto Maple Leafs for a year.
Nice.
And so, I did. This is applicable because most of my career was wrestling on the ice, so so this works out well. There wasn't a whole lot of scoring and stuff like that. A lot of wrestling on the ice, so this is good.
Okay. And imagine like when you were competing or when you were on the ice when you're playing, you may have had concussions or been.
Yeah, I had definitely had a few over the course of my career, and I was the first year that helmets were mandatory. So most of the guys I played with and played against when I got to pro weren't wearing helmets at all. So there was a lot of stuff that went on that not that as we know now though, we know helmets don't make a big difference. Mm-hmm. You could put a house on someone's head. It's about the sloshing of the brain inside that really causes a lot of the issues. So, yeah.
But we were talking about helmets, right? You're talking about how you played without helmets, and then you played with helmets.
Right. Yeah. So, growing up, I played with helmets all along, and there wasn't much to them at the time. Mm-hmm. But like I said, the research is showing that helmets don't make that big a difference. They'll protect from outer head injuries and maybe a skull fracture and cuts and bruises and stuff like that. But as far as what goes on inside the head, the helmets really don't do a whole lot. And that's why you watch American football, and these guys they're doing all kinds of research all the time to try and figure out the best helmets for these guys. Mm-hmm. But they have more concussions than any other sport there is, even more so than rugby, for instance, which they don't wear helmets, and they don't seem to have as many concussions as American football does. Yeah. So it's a lot about what happens inside the head, and then also the neck is a huge involvement, and that's what we found actually with you. Mm-hmm. A lot of the stuff you were dealing with was a function of the brain situation itself, but because of the way you got hit in the motor vehicle accident, the head moved back and forth, creating a whiplash scenario, which not only affected the brain but affected your neck. And then there's a huge interrelation between the two there. So, and that's how we got going with that, and that's how we got into this as chiropractors. Mm-hmm. It was about probably 15 years ago now. I ran into a fellow who was working with a company called StopConcussions.com, not a company, sort of a charity almost. Mm-hmm. And he introduced me to a fellow in Guelph, Dr. Scott Haller, and they've been working with the University of Pittsburgh, which has the biggest concussion center in the world. Mm-hmm. And so we met up, and all our training comes from the University of Pittsburgh, and they're the ones that develop the neurocognitive test called the impact test, which all the pro sports teams do before the season. They do this
baseline testing.
Mm-hmm. And it's a computerized test, plus they do some vision testing and balance testing, and they're the ones that developed all that. Mm-hmm. And when Sidney Crosby had his concussion, and there was a lot, he wasn't responding, that's where he ended up going, and they were able to help him out. So all our stuff that we do here through Shift Concussions is all based on the University of Pittsburgh's concussion center. So the chiropractic side, I guess, is the neck component, but we now are, every day we're learning stuff. Compared to when we started with you 5-6 years ago, what we've learned, well, you've had a recent one too.
Yes.
And you're probably seeing some different stuff that we're doing now compared to when you originally came in too. So
yeah. And yeah, that's why we're doing this podcast. I thought, I've been a victim of concussions, throughout my sporting career.
Sure.
I have never actually experienced a concussion from, like a motor vehicle like the one I did in the beginning.
Right.
And the second motor vehicle that I've gone through has made it, it's been worse.
Yeah.
I find.
Yeah. That it is a, what's the word I'm looking for? It is cumulative. What happens inside the brain. And that's why it's so important after that first concussion to really manage it properly, to try and reduce the amount of cumulative effect over the course of time. As athletes, things are going to happen. We're going to have things where we whack our head or have our neck twisted a certain way and stuff like that, and we're going to end up with concussions. But the key now, and we're learning more and more every day, is just how to manage them correctly so that when you return that person to play, they're returning safely with minimal stuff going on in there that can cause a cumulative effect. So before it used to be rest, the parents, they would tell them, wake them up every so often, just rest, see if you're okay, and then boom, you're back out there doing stuff. Now it's about the first 24 to 40 hours, you really want to let them just totally chill out, even in complete darkness. And they'll tell you when they're ready to come out type thing, but you want them, just complete neurological rest. So dark room, sleep as much as you want, don't wake them up. You monitor them to make sure they're breathing properly and stuff like that, obviously. And you keep an eye for any red flags and stuff like that. But now it's about that initial phase is a rest and restore phase. But right away, as quickly as possible, you want to get them back into engaging in life, basically. So some cardiovascular work, get them out walking, with a hat and sunglasses on to protect the eyes. Get them back doing a little bit of reading and schoolwork and stuff. You try and keep them away from electronic screens and stuff like that. But other than that, you want to gradually introduce them back to life and their sport, but just graduate it as much as possible, as opposed to not doing anything. So.
I went to my GP this time around.
Right.
And I was told rest. And then I started doing research, and cocooning is that's what basically they refer to it as is resting for weeks. They're saying no, that's not to do that anymore.
Absolutely, that's the worst thing you can do.
Yeah.
So that's why you really want to, things like walking, some gentle aerobic work just to get blood flow into the brain. You know what I mean? You want the brain. What we sort of say is work. If 10 is the worst you've felt and 0 is feeling great, you can sort of push yourself to a 2 or 3. And try and not go beyond that, because that may set you off even more. But pushing to a 2 or 3 actually helps stimulate things to get things working properly again. So that's why you don't want that cocooning anymore. And unfortunately, in the medical field, what we've learned over the last 10 years or so has changed so rapidly. A lot of the medical profession hasn't been able to keep up with it. They just don't. They don't know, unfortunately.
Yeah.
Even emergency room physicians, some of the stuff I hear that they're telling these people to do when they come into the clinic, it's just like, sorry, that's not, we want to try and get you going again. We want to get you back to life, because the thing that happens, especially if you're a kid and you have a situation like this, you cocoon them and you don't let them do anything. Next thing you know, you're dealing with the psychological component of depression. Now you've got even more on your hands, you know what I mean? So you really got to graduate them back into life as quickly as possible.
And that's one of the symptoms of concussions, right? The depression.
Yeah,
you're dealing with the brain. There's so many I guess things that go on with the brain. My journey, I experienced the irritability that I didn't realize how it manifests itself. Sometimes it just creeps up on you. You don't really, you think it's just kind of a part of normal life.
Right.
But then you start to realize you're doing things that you don't normally do. Like, you'd be driving down the road, and usually, if you get cut off, it's not something that really bothers me too much.
Yeah.
But then I would do something out of character.
Yeah.
The headaches, I thought it'd be constant headaches for me. I don't know if it's different. Mine is like a stabbing in the brain when I'm exposing myself to stuff like the TV or phones, I guess. We don't have telephones anymore. You remember what those are. Yeah. But yeah, the symptoms, you like I learned from you guys, is that I need to push it a little bit, then back off.
Right.
When I start to feel those pains, when I start to get irritable, back off, and then
yeah, absolutely. And that's how you integrate back as quickly as possible by just managing that. And you know, we're only spending so much time with you, so you hope that people don't push it too much, thinking they can do more or whatever, you know. But you do want to push it that little bit just to sort of stimulate everything.
Yeah.
And like I said, not just physically, but mentally too.
Yeah.
You know, as you know, we test the eyes. So you're right. It's every part of the brain can be affected, right? Depends on which part was affected with the blow or the whiplash type scenario. But we do eye testing, balance testing, a lot of vestibular work with the way the eyes and the your balance system work and stuff like that. And it's amazing what you find. So you really have to try and restore, particularly the eyes, because the eyes use about 70 to 90% of the brain's energy, depending on what you're doing. So if they're constantly not functioning properly, and the biggest thing is them functioning together, if they're not working properly together, then the brain just is on overload all the time and it can't settle down. And what you'll find is you'll get someone settled in that first 24 to 48 hours. They feel great, and then they go and start to do something. But if the eyes aren't working together properly, or the vestibular system, your balance system isn't working properly, it just sends them right back into a tailspin, and they can be right back to where they started. So that's why you have to really, nowadays the assessment is so important. Really get to the bottom of what's going on with them, and then start adding stuff back in that can restore that type of stuff.
Tell me what a typical patient for concussion comes in here. What kind of I guess assessment? How does the assessment work?
So if we haven't seen them for like a baseline testing, like in an ideal world, we'd have someone that we'd done a baseline test on, so we know what they're like prior to the concussion. But that doesn't happen very often. We do a bunch of testing for teams and stuff like that, and we will see some of those kids. And it's great because then we can compare where they're at and see what we have to work on. And then we also know when they're ready to head back safely, when they're basically back to where they were at their baseline. But even in baselines, we pick up some stuff with the eyes and that too, and we're like, man, you shouldn't be out playing contact sports right now because your eyes aren't working, and they've been playing all along, you know what I mean? But a patient will come in, and one of the biggest things is just the key is the history. You sit with them and find out how the best you can how the incident took place. You know, if it was a motor vehicle accident, for instance, people can say, oh, it was a whiplash, but you know, did you get hit straight from behind? Did you get hit on an angle? Because that creates, if say someone gets hit on an angle, that creates a rotational force as well as a forward and backwards force, which causes even more problem in the lower part of the brain, where the neck meets the head. So the history is really important. You got to really get to what happened and then into what they're feeling now, because that'll tell you sort of the systems you're working with, and then get into the testing, which is, as I mentioned, the eye testing. So with the eye testing, we'll do just some typical eye testing for movements, and then we do what's called binocular vision, so how the eyes are working together. And a lot of times with someone with an acute concussion, we'll find stuff that has gone on, as we did with you, you know what I mean? So then we provide exercises, because the great thing is a lot of times it's not a neurological issue with the eyes. It's more of they just get out of sync, so it's more of a muscular component. There's so many muscles that work with the eyes. So you just train them back to work the way they were supposed to. And then same thing with the balance of the vestibular system, as I was talking about. You'll find stuff going on with that, and you start giving them exercises to try and restore the way that functions. And then we'll work on the neck as well too, if need be, because that plays a big role. And a lot, like with your situations, both you've had a lot of neck stuff, so that's why, you know, you see Scott for massage, and then we're doing a little bit of manipulation and some soft tissue work and stuff like that. So
I remember coming in and you know, we were working on my eyes,
right,
and I wasn't able to track, and I could feel as I was supposed to watch I don't remember if it was a finger or what I was supposed to watch, but my eyes would jump. I could feel them, you know, the one jump. It was an awkward feeling. And then we started doing the exercises, and I didn't realize how many muscles or how we utilize their muscles in your eyes, because you take that for granted, I think, most of the time.
Yeah.
And then when you start actually exercising your eyes, the exercise that you gave me, the charts and stuff like that, where I had to do head movement and then run or walk with it.
Right. Yeah.
Started to stress my eyes too, because I was working my eyes back and forth, just like working a muscle.
Right.
Yeah.
And that's you want to push that limit to a 3 out of 10 maximum, and then stop there.
Yep.
And then next day or 2 days later, try and do a little more and a little more, and you just keep trying to restore that system as far as that goes. Both the eye. So what you were talking about with the eyes and turning the head, and that's your vestibular system. So when our eyes should be able to stay on a focus on an object, for instance, and the head be able to move all over the place while the eyes stay on the object. And a lot of times you'll find that someone tries to do that, and right away it sets off their symptoms and that. And then we know there's an issue with the vestibular system, and we start them back slowly with exercises and such. So, yeah.
I can remember being on the treadmill trying to do that, falling off because I'm like, I pushed it too far today.
Well, that's the concern, is you don't want to, we get them on a treadmill, we get them doing some vestibular work, and the last thing you want is them falling off and concussing themselves even further. So. Yeah. No, you got, and that's the problem with athletes, I think. As an athlete, that was my background. Of course, I'm older now, so I'm more susceptible to those injuries. But as an athlete, you have that mindset that I'm going to get out of this and I'm going to push it. I'm going to keep pushing it. Right. And with concussion, that's not recommended. No, you want to push it, but as I said, you really want to monitor how far you push it, and not too much. It's just got to be a gradual thing. Yeah. But I think, I can remember, for instance, famous hockey player Mark Messier, back checking on him, and I sort of had him held up a little bit, and I thought, okay, I got this guy. And he just threw a flying elbow, caught me right in the jaw, and I went down, and I was like Bambi on ice. I'm trying to get up, and the legs are going out, and the arms are going out. I got up somehow, got to the bench, and I think 3 shifts later I was ready to go out in the ice again. Well, I thought I was ready. And that probably explains some of the stuff I'm dealing with today, for crying out loud.
You got any video of that one?
I don't know if there's any of that one. There probably is, because it was I was playing for the Leafs at the time. It was at Maple Leaf Gardens, so there probably is some video of that.
So we'll be able to find that somewhere.
Yeah, there's some videos of, I said, the wrestling on ice, like we talked about. So I wasn't a very good fighter, but I had to do it every once in a while. So that's where I really worked on my grappling. I got in there and held on the best I could. So
nice. And as a result, you paid for it sometimes.
Yeah, I'm still paying for it. I got hip replacement surgery coming up in 2 weeks' time, and
there you go.
Yeah, so I get worried. I'm always sort of checking my memory and stuff like that, and checking different things that might be related to previous concussions, because I've seen so many guys that I played with who are struggling with dementia, and everyone understands that one, but things like concussion, Parkinson's.
Okay.
Lots of guys dealing with Parkinson's, like way more than the general population. And the other one is Lou Gehrig's. We've got several guys that have dealt with that and are dealing with that and passed away because of it. Yeah. And I'm pretty sure it's related to
concussions,
yeah. And no one will say that, but as far as the league goes or anything like that. But it's just, when you look at the general population and the number of people that end up with this, and then the number of NHL hockey players, and probably, I'm sure, football players and stuff too. It's just, there's way too many.
And that's from repeated blows to the head,
for sure,
and not getting treatment.
Absolutely.
Yeah, because back in that day, it was kind of, get up.
Yeah.
Yeah. Shake it off.
Yeah, shake it off. Yeah. You just got it. You took a stinger or whatever they call it. But, you're down, you're up. All right, you're good to go. Actually, my sister's boyfriend in high school was down at Cornell University playing football, and he had a bad head injury, I believe, and they put him back out in the field, and boom, he was gone. So he just. I don't know what the final diagnosis was. We never did, but it was definitely related to hitting a head injury and then going back out way too soon, or not being. Well, we didn't know. You can't blame anybody. You just didn't know back then. Yeah. So, but things like that happen and have happened too often.
Yeah, because I remember. So when I was my first concussion, I was hit. in the car at work. I was driving to, from what I remember, going to a gun call, and I got hit. Anyways, the impact, I got to the hospital. They checked me out for anything, like physically.
Yeah.
The doctor just said, if you feel like you have a concussion, here's the symptoms, come back and see whatever. I walked out of the hospital and I didn't think I had anything wrong with me.
Right.
And then, I think I slept and I woke up and it was, I wasn't able to remember words.
Yeah.
Words that were, would have come natural to me.
Right.
Exactly then is that, there's some issue.
Yeah.
But as far as, game situation, if I was hit, and I'd be like, I don't feel anything, I'm going to go back in.
Yeah.
That's where the danger lies.
If they're, they would be looking for red flag symptoms, vomiting, bleeding out of the ears or other areas, stuff like that. Just sort of fainting, collapsing. There's a whole list of red flag symptoms that we have. So that's what we tell parents. You obviously want to watch for those. And if any of those appear, boom, you got to get them to the emergency room right away. But other than that, a lot of times back then they would have just out you go. Yeah. So that's that was a concern for me. So when I met the guys from Stop Concussions, that's how we thought, there's got to be a better way to treat, which Shift Concussion has shown us, and it's like I said, it's ongoing. We're training with them all the time. We now I think you've got some stuff from Doc Ryan with regards to the app. So we have everything on an app now through Shift Concussions, and that gets any videos and a lot of explanations too that people can understand better of what they're dealing with. But any of the exercises we give are now all on video and stuff that can follow that along, and that's a bit of a fine line too, because you tell them, we don't want you on the screens for the first little while, then we're going to send you some exercises on video. So but it again, that's where you're able to push people a little bit, and they just got to manage that. So on the note of Stop Concussions, I think we talked about this a bit. It's probably taken 4 years now, but I just completed a book called the Concussion Prevention Playbook. So my thing was, we were seeing all these kids coming in and guys like yourself coming in. Obviously, you're in a motor vehicle accident. There's not much you can do there. But kids coming in that were concussed, and even having to tell some of these kids and parents, so, this is your third time around. I don't think you should be playing hockey anymore. I don't think you should be playing football or rugby, whatever. And it's devastating to have to tell the parents and kids this, right? And so I thought there's got to be certain things that could be done. And I started to notice certain things with kids that were coming in particular. And I think a lot of it is, so in writing the book, the Concussion Prevention Playbook, it was the very first thing I got to was posture. And kids nowadays on their phones, at computers, we're seeing all kinds of rounded shoulders, head coming forward. Speak of the devil. The head coming forward. So now you're in a position, think of if you're playing a sport, if the head's sitting properly over top of the shoulders, the head's not leading, you might get hit in the chest or such. But as soon as you start to come forward like this, now the head's leading, so it's more prone to taking contact. It's in a much weaker position. The neck and head are in a much weaker position than it is when it's sitting properly. So now your chance of whiplash or even just a simple hit and rotation are much greater. So that was the head component, like the concussion component, and then we're seeing all these shoulder injuries coming in from simple little contact that shouldn't have happened, but because the shoulders are sitting forward, now they're more prone to a rotator cuff and a separated shoulder, an AC joint sprain, even dislocations. We're seeing way too many because just posture is so bad. So that's the first thing I talk about in the book is posture and ways you can improve your posture, and why it's so important to make sure you've got good posture, because it can I think just that alone would help out. Not eliminate, obviously, but help prevent some concussive incidents. And even if you are in one, it might help reduce the potential damage you do. You know what I mean?
Mm-hmm.
And then we talk about neck strengthening, which I was anxious to talk to you about this because being a wrestler and everything with your background,
Yeah.
you guys do all kinds of stuff for the neck, right?
Yeah, we bridging
And all that stuff. And football players do a lot of that stuff too.
You would hope.
Yeah. But the research now, there's a guy, Dr. Theo Versteeg out of the University of Western Ontario.
Okay.
They've done a bunch of research and showing that really typical neck strengthening, that bridging, even using equipment and stuff like that, it doesn't reduce the incidence of concussion. And it didn't make sense to me. I'm like, that doesn't make sense. You'd think if you're stronger up through there, there'd be less of a whiplash effect, or the stronger your neck is, the less the head would move this way if you got hit, creating reduced slosh in the brain, right? But the research was showing that. And then he realized there is a certain type of strength you can do, and he developed, it's the coolest thing. I think I'm trying to think of the name. It's something 360.
Okay.
And it's a football helmet.
Mm-hmm.
And it's got a like a rod on top and a cylinder, a weighted cylinder, and it's I don't know whether it's moved by magnetics, like electromagnetics or whatever, and it makes the head go around, and that's a way of strengthening the head, and you can increase that. And I think they were doing it with, I might be wrong, but I know it was one of the NFL teams. I think it might have been the Detroit Lions last year, and their incidence of concussion was next to nothing from doing this type of strengthening. And but it's a pretty funky looking outfit.
Yeah.
So I looked into it. It was just, for the amount of concussion work we do, it's just too expensive for us to use, but it's a, for a pro football team, it would be an amazing thing to have.
Yeah, I've actually seen that before.
Have you?
Yeah. So no, you said that because all the research that I've been doing because of the concussions that I've endured, I've been looking at things, but and I have a few football helmets at home. Maybe I should
make your own,
my own. So,
well, one thing I asked him, because I called him about it, and we were talking about the research, and I was seriously looking at the equipment, but you have to buy all different sizes and everything, so it gets pretty expensive.
Yeah.
But I said, is there anything you send someone home with that they can do besides, just using the helmet scenario? He says, he named it the Versteeg tumble or something. And basically what you do is you sit and you fall backwards on your bed or on a mat, and you fall back and you stop yourself from your head from hitting the mat.
Okay.
And that type of strength, training that type of way, can make a big difference. And I started thinking about that, and I thought, man, as a kid, growing up, we didn't have all the electronics. We're outside, climbing trees, doing all kinds of stuff. You sort of learn that on your own.
Yep.
You know what I mean? And I remember playing men's league a few years ago, and a guy took my feet out from underneath me, and I fell right on, like feet right up, fell onto my back. But just out of instinct, I was able to keep the head from hitting. So there's got to be some neck strength component there, but just the way to utilize that neck strength is what this Dr. Versteeg's talking about.
Yeah. So
I thought, well, I still think some neck strengthening is important. So we're going to provide some exercises. Like in the book, there's going to be you can hit a Q code and it's going to take you to a YouTube channel.
Okay.
And there'll be exercises on there to do.
Awesome.
But so we're going to do the one also falling back and on your bed. So if you do go back, you hit, no big deal, right?
Yeah.
But I'm also going to have them falling sideways, like landing sideways and stopping the head from moving, or if you can, like really try and stabilize it, and even falling forward and stopping the head from moving.
Yeah.
Because I think all those would be beneficial too. But you need core strength and everything else to help prevent some of this stuff. Yeah. So, and then we're doing shoulder strengthening in that because of, with the postural stuff, just to really try and improve posture to get these kids back in better posture, because it's really become, for lack of a better term, an epidemic. You know what I mean? So you probably see it